Hi everyone. Today we'll solve some more questions related to anesthesia, which will be very helpful for your CPC exam. Let's begin. Read the question. A 48-year-old patient receives general anesthesia for an open procedure, pleura biopsy. An anesthesiologist medically directs 3 other cases and medically directs a CRNA in this case. What are the appropriate codes for both providers? Let us check the options. They have mentioned the codes 00540 and 00541. So let us check those two codes. 00540 is for anesthesia for thoracotomy procedures involving lung, pleura, diaphragm and mediastinum, not otherwise specified, and 00541 is for anesthesia for thoracotomy procedures utilizing one lung ventilation. But in the scenario, anywhere they have not mentioned utilizing one lung ventilation. So we'll eliminate the options with the codes 00541, that is option B and option D. Now we are left with option A and option C, the differences between the modifiers. So check modifier AA. Modifier AA is for anesthesia services performed personally by anesthesiologist. And modifier QZ is for CRNA service without medical direction by a physician. But according to the question, the anesthesiologist medically directs 3 other cases and medically directs a CRNA. So we cannot code modifier QZ, so we'll eliminate option A. So option C is the right answer. We'll check the modifier QK. QK is for medical direction of 2, 3 or 4 concurrent anesthesia procedures involving qualified individuals. You can check in the scenario. The anesthesiologist medically directs 3 other cases and medically directs a CRNA. That is modifier QX is for CRNA service with medical direction by physician. So option C is the right answer. Next question. Read the question. A healthy 32-year-old patient receives an urgent vaginal hysterectomy following delivery of her 3rd baby. What anesthesia codes should you report for this case? Let us check the first code from each option. In option A, they have mentioned 01962, which is for anesthesia for urgent hysterectomy following delivery. 01967 is for neuraxial labor analgesia or anesthesia for planned vaginal delivery. 01963 is for anesthesia for cesarean hysterectomy without any labor analgesia anesthesia care. In option D also, the code is 01962. So among these 3 codes, which is the right code? The right code is 01962. That is for anesthesia for urgent hysterectomy following delivery. You can check in the scenario, they have mentioned urgent vaginal hysterectomy following delivery of a 3rd baby. So the appropriate code will be 01962. 01967 will eliminate because that is for neuraxial labor analgesia. 01963 will eliminate because that is for anesthesia for cesarean hysterectomy without any labor. So that is not matching with our question. So eliminate option C. We are left with option A and option D. In option A, they have mentioned the second code 01969, which is for anesthesia for cesarean hysterectomy following neuraxial labor analgesia or anesthesia. Below that, they have mentioned use 01969 in conjunction with 01967. So the code 01969 will be wrong if we use for this current scenario because they have not mentioned anesthesia for cesarean hysterectomy. Here it is anesthesia for urgent vaginal hysterectomy. So eliminate option A. We are left with option D, which is the right answer. And modifier P1 is used for a normal healthy patient. They have mentioned healthy patient. So option D is the right answer. Let's move on to the next question. If you want to study anesthesia guidelines and practice some more questions related to the section anesthesia, then check my playlist CPC Exam Anesthesia series. The link will also be mentioned in the description. And also don't forget to like, share and subscribe to my channel CodeMed Mastery. Read the question. A healthy 32-year-old with a closed distal radius fracture received monitored anesthesia care for an ORIF of the distal radius. What is the correct code for the anesthesia? The full form of ORIF is open reduction internal fixation. Now let us check the options. Before checking the modifiers, we'll check the code. So check these two codes 01830 and 01860. 01830 is for anesthesia for open or surgical arthroscopic endoscopic procedures on distal radius, distal ulna, wrist or hand joints, not otherwise specified. And 01860 is for anesthesia for forearm, wrist or hand cast application, removal or repair. So which among these two is the appropriate code? Read the scenario. They have mentioned ORIF of the distal radius. So ORIF is open reduction internal fixation. It is a open procedure. And 01830 is for anesthesia for open or surgical arthroscopic endoscopic procedures on distal radius. So 01830 is the right code. 01860 is wrong. So eliminate the option which has 01860. We'll eliminate option B and option D. Now we are left with option A and option C. So in both options they have mentioned P1 modifier, that is for a normal healthy patient. That is correct. Now we have to check whether the modifier QS is required or not. Modifier QS is for monitored anesthesia care service. So check in the question if they have mentioned monitored anesthesia care service. They have mentioned received monitored anesthesia care. So we have to use the modifier QS. So the right answer will be option C. We'll eliminate option A. I hope you are clear with it. Next question. A 50-year-old male has a left subcutaneous mastectomy for cancer. She now returns for reconstruction which is done with the single TRAM flap. Right mastopexy is done for asymmetry. Choose the correct anesthesia code for this procedure. 00404 is for radical or modified radical procedures on breast. 00402 is for reconstructive procedures on breast, reduction, augmentation, mammoplasty, muscle flaps. 00406 is for radical or modified radical procedures on breast with internal mammary node dissection, and 00400 is for anesthesia for procedures on the integumentary system, extremities, anterior trunk, perineum, not otherwise specified. In the scenario, they are performing reconstruction which is done with single TRAM flap. So, which code is matching with the scenario? 00402, which is for reconstructive procedures on breast, example reduction or augmentation, mammoplasty, muscle flaps. So 00402 is the right answer. 00404 will eliminate because that is for radical or modified procedures. 00406 also is for radical or modified radical procedures on breast with internal mammary node dissection, and 00400 is for anesthesia for procedures on the integumentary system. But we have to specifically code according to the procedure. So option D will eliminate. The right answer is option B. Next question. What intraperitoneal organs are found in the lower abdomen? Option A, appendix, cecum, ileum and sigmoid colon. Option B, liver, appendix, gallbladder, ileum, sigmoid colon. Option C, gallbladder, cecum, spleen, ileum, sigmoid colon. Option D, spleen, liver, appendix and cecum. While discussing anesthesia guidelines, I have mentioned the list of intraperitoneal and extraperitoneal organs in upper abdomen and lower abdomen. You can check that video. So, the intraperitoneal organs that are present in the lower abdomen are appendix, cecum, ileum and sigmoid colon. So, the right answer is option A.